realmedicine.tv. High-profile, reality-based investigative medical reporting. Medicine and staying young. Today's most fascinating topics. Accessible, personal, energetic, uplifting. Cutting-edge information from world-renowned medical doctors, researchers, health professionals, and patients. Focusing on solutions to deal with medical and health obstacles as a winner and a survivor. Weekly one-hour episodes connected to an interactive online medical library. Hosted by an investigative and engaging international medical doctor, Martina Fuchs.
People die of
age, or wouldn't it make sense for
realmedicine.tv.
Today, 1 million Americans are living with HIV and AIDS. The numbers, especially among women and young people, are increasing rapidly. HIV infection-related diseases are the second leading cause of death among 25 to 34-year-olds, but it is not a death sentence anymore.
I fully expect my patients living with HIV right now to live completely normal lifespans. I've been treating HIV patients since the epidemic started in the early 1980s, and I've had a special interest and expertise in patients who have what's called the wasting syndrome, where they get very, very skinny from the disease and some of the opportunistic complications. I think there's nothing like watching people die a very slow, painful, horrific death for people to understand that this is something they don't want to get.
People ask me, well, what is the greatest thing that ever happened to you in your life? And I know it sounds wacky, but it's when I found out I was HIV positive.
What changed in your life when you realized that you can actually die?
Slowly but surely, it just sort of dawned on me that to look at life differently, and not to look at it in the sense that it's it goes on forever and ever, and that everybody dies eventually.
The most difficult part of being HIV positive was knowing that through getting to know somebody more intimately, that you could transmit this horrible virus to them.
We're seeing just the population of HIV-infected people in the United States continue to rise, people living with HIV. And people, if you have a higher population of people living with HIV and they're feeling healthy and they're sexually active and people are not paying attention to safe sex, they're going to transmit it to others. So we're very concerned that the HIV epidemic is going to continue to expand. I think a lot of people will still think a person with HIV as a person who has a death sentence, and it's not true. Now we wait until the T cells hit 350 or less, where the viral load is above 55,000. And that's actually a big change. That just came out in January 2001 from the United States Department of Health and Human Services.
That's very interesting. That's very new.
Brand new. Absolutely hot off the press.
So there's a lot of hope.
Lots of hope. And I think it's a different disease than it was even 5 years ago.
Human growth hormone, HGH, has been used to treat AIDS patients with wasting syndrome to add muscle mass. Now, healthy individuals are calling it a fountain of youth.
And growth hormone is a fascinating compound because it's very, very, very anabolic. It helps people maintain what we call nitrogen balance. It helps people maintain their lean body mass, and it works very rapidly.
I did it to gain some weight, and because my doctor was concerned that I didn't have enough muscle mass at the time.
How long did you take it?
I took it for about 3 months.
And after you stopped everything?
Then I just lost everything, It was like, I was really tight and, buffed. I looked like I worked out every day.
Certainly, growth hormone can have very positive and beneficial effects. But it's difficult to come up with compelling evidence that growth hormone actually increases quality muscle. And what we mean by quality muscle is when there's an improvement in strength and function.
Our application is an oral spray, which is called GH, or growth hormone. It's in micro solutions, so it's just a very small, almost like a homeopathic dosage, just enough to but strong enough to stimulate your own pituitary gland to start releasing growth hormone the way it did in your 20s.
We have seen some data in older people where it's actually helped older men, especially their functional abilities and muscle strength and coordination. I just think it hasn't been fully worked out in terms of what dose to give, in what patients, what parameters we should measure to make sure we're not getting into complications.
You have personal experience using this?
Yes, I do. I lost 4 inches around my waist, gained lean muscle. My body fat actually went down. My lean muscle count went up. Growth hormone even enhances libido for men and especially for women. I think we're just reaching the tip of the iceberg as to what the possibilities are for anti-aging, longevity, and vastly improving the quality of life.
It may be a wonderful treatment in the future for those of us baby boomers who may need it, including myself, but I think it's not ready for prime time quite yet.